to today's Research to Practice. Today we're going to talk about one of the early articles on joint attention, written by researchers from UC San Diego, and Professor Laura Schreibman has retired. She has been really the front runner for joint attention autism research. Now, look at the article Joint Attention Training for Children with Autism Using Behavior Modification Procedure. The term behavior modification is relatively a very old term. Still, there are a lot of information from these articles are very relevant to parents, and I will highlight one of the features in the study. I think it's very important. So in this study, they have 6 children who have autism, 5 children who have autism, and 6 children who do not have any developmental delay or concern. So why do they have 6 children that without disability? The reason why is they try to figure out how often do these children initiate joint attention. They look at their parent, they shift the gaze, they look at the book, and then look at their parent. They make sound to get picked up. They point, they use their little hands to gesture. So what they found is these children initiate about 1 every 10 seconds. So every 10 seconds, they, on an average, they will point, make vocalization, use eye gaze to get your attention. This is important because with the training, this is going to be their reference. This is going to be the target the children on spectrum. You say, okay, they have reached the criteria because they have point or using other means to communicate, initiate joint attention every 10 seconds. The study used a combination of intervention. One of them is called the pivotal response training, and the other one, many parents might be familiar, is called discrete trial training. Now, both are based on applied behavior science. They look different. The DTT is what we are familiar with. They are very structured, right? You say, what is this? Your child said it's a bear, and you say, yeah, that is a picture of bear, good job. So that's like clear your instruction, your verbal instruction, for example, and then the child behavior, and then there's a consequence. You either give the reinforcement or you don't give the reinforcement, but there is a consequence. Now, PRT is also based on applied behavior science and talk about reinforcement, talking about very clear, precise instruction, but they also emphasize that the child motivation, we're gonna give them choices. We're gonna combine the mastered task with new task so that child can feel the confidence, can feel not so overwhelmed by the new task. In pivotal response training, if a child asks for candy, you give the candy, of course, right? Then because we're teaching, requesting. Just to summarize the difference between PRT and DTT, you can think of DTT as more structured, adult-led. There's a lot of trials, repeated trials for one target, and PRT, it differs in that you look more at child motivation and you look at skills, the pivotal skills like initiating joint attention. But those two techniques have a lot in common. I'll encourage parents to not hang up on what is called, but focus on actually what strategy that you can use at home. Terminology is not that important. What important is what you can put in your 5 for 15 minutes session and use some of that strategy to help your child. The first strategy is using prompts. And when you use prompts, make sure you give your child time to process. Say you are using a ball as a way to teach responding joint attention. And then you found a ball and say, look, and you want to wait and for your child response. And then if your child is not responding, you may move closer or grab his or her little hand to point at the ball. That's your gestural prompt. And again, you wait for how your child responds to your prompt. The second strategy is a very important one, and I think we do this a lot as parents, is when you teach new task, make sure you mix it with the ones your child already knows. If you are teaching, say, blue car, if you are teaching push, right? And so make sure some of that is what you have worked on before. If I have 4 activities to work on during the 15 minutes, and 3 of them probably something your child is very familiar with, and 1 maybe is something that's new. We are teaching pointing today, point at the ball. So the 3 other things might be really easy. Push the ball back and forth, and looking at some pictures we looked before, a book the child is familiar with, and only 1 thing that's new that your child has not been taught before. The reason why is that by mixing the master task the child already know and the new task, you are keep your child motivation really high. The third one is have your child choose activities. And we talk a lot about observing your child, follow a child lead, and be a shadow and not just directing the child to play every single moment, bombard the child with questions. So this is really about follow the child lead and then pay attention to what your child is actually interested in. If your kiddo walks to a basket and start to explore, don't say, oh, we have to do ball right now. We can do that later. Follow in, see what he or she's in, what your child is interested. And then, oh, you want to help with the basket? That looks heavy. You can say, help. You're teaching communication. You're also teaching your child to initiate, right? Initiate joint attention using gesture, help. The next one is taking turns. My turn, your turn. Keep that balanced ratio. At the beginning, encourage your child to take more turns and then jump in when you feel like your child is stuck. Another one is, we call it contingent reinforcement. What that means is that you provide reinforcement after your child correct response, so that your kiddo has a very clear understanding is that, oh, I get the toy right away when I said, "tuh," and because of that relationship, keep repeating itself again. I said this, mommy gave you that right away, and then that will help brain to make the connection between the object and the words. If your child requests the ball, of course you're going to give the ball, not the candy. It's such a common sense thing, is you want to make sure what the child is requested is actually given to the child so that we are encouraging language. Otherwise, it's just really confusing. So we have talked about the participants in this study. We talked about different techniques they used. And next, I want to talk a little bit about the levels of responding joint attention training. Now, one thing about behavior applied science is things are very structured and everything is spelled out to much detail that other people can replicate. This is one of the studies that, if you are struggling at home, you are thinking to yourself, oh my goodness, how am I going to start? Where am I going to start? This study has laid out 6 levels for you, 6 levels of how to teach response. Let's talk about the first level. The first level is respond to hand on object. Picture a child is playing with a ball, and you bring another toy, and then you place your child's hand on that toy and see what your child does. This is really about engaging the object, right? If I show you object, what do? Do you take it? Do you look at it? That's the level 1. In the level 2, it's very similar to level 1. This time, instead of just put the hand on the object, what you're doing is you are tapping the object. Say your child is again playing ball, and then you bring some other toy in the room. Say is a potato head. And you tap the head of the potato head and then saying a potato head and see what your child does. Again, it just responds to different way a person introducing an object. And then level 3 is response of showing of an object. And here the adult may say, look what I get, right? And the first one is really you are putting his hands or her hands on objects, see what your child responds. The second one is you are tapping the potato head. And the third one is you say, look what I got. It's a potato head. Level 4 is getting even more difficult. This is very intricate. Level 4 is the eye contact is trained for this level. So your kid is required to make eye contact with you in order to gain access. Now, I would say I often skip this part because now from the research, nowadays we know that, you do not have to stare at someone to have that joint attention. And actually, a lot of adults on the spectrum has reported making that eye contact it's very uncomfortable for them. So even the kid just look at peripheral vision and turn the head toward me, and I'll give the toy right away. The level 5 is following a point. We all know that gestural point, distal point, it's very, very important. That's one of the red flags of autism actually, is we're looking for whether the child points to communicate. Look like is you will put, say, a basket of toys or just one toy you think your child really like, a potato head again this time, for example. And while your child is playing and you point at the potato head and wait for your child response. During your 5 or 15 minutes, just try different strategies listed here and record your data and then think about what went well during the session, what didn't go well. And I think many times we may just really a matter of experimenting with the different things, right? So, for example, when you follow a point at the level 5, try not talk during that time, just simply point at the object you want your child look for this responding joint attention task. And so that your child is used to the point gesture and not just the language. And then later on, you can start to point and use the verbal language. Look, what is that? And so you are introducing one signal, which is a pointing, and the other signal is a verbal signal, which you use all the time with your child. And in a natural environment, often we just use both, right? Look, there is an airplane, and you don't just point, don't say anything. But in the initial teaching phase, just make that point very salient. You may want to just exaggerate that gesture and eliminate the verbal prompt so that your child can respond to, okay, that's the pointing mom is trying to show me. In that way, I can get a toy that I like. And the last one is the highest level is following the gaze, where you look at a parent gaze, and then if I'm looking at a picture on the wall, in this experiment, they have a different pictures on the wall. So if I look at the picture, shift my gaze there, can you also shift your gaze to that picture? So this is the part that a lot of kids struggle, is the social cue, the shift the gaze and what the person looking at. And in this phase, you're turning your head and shift your gaze and look at the new object, and then training your child to look at the same direction. To summarize, level 1 is respond to hand on object. Level 2 is you tap an object and then see your child responds. Number 3 is showing an object to a child. See what I have. And then number 4 is eye contact. As I said, I often skip that one. As long as the child just turn their head, look at my direction, that's perfect fine. We do not have to make a child have to have the eye contact with us. And number 5 is following a point. And then the last one is following eye gaze. And there's a new picture. I turn my head and shift my gaze, and the child would do the same thing. Now, in this experiment, for the reinforcement procedure, they gave the toy if the kiddo is able to do the task. Shift the eye gaze, look at the new toy, tap the toy, hold the toy. But if the child didn't do that, the researcher actually did not give the toy to the kid for 10 seconds. For some children, this can be very hard. This can trigger a lot of behavior. So If that happens, what you need to think about is tolerance training. And do not go from not having toy for 1 second to not having the toy for 10 seconds. You want to gradually increase that duration. And we'll talk more in our other research to practice about problem solve when your child has trouble tolerating that duration. Hopefully you found this article helpful, and I'll see you in the next R2P episode.